Hello everyone, I hope you are doing well today. In this video, we are going to talk about something very important, especially for people over the age of 60, that is diabetes, and more specifically, the early signs of diabetes in older adults. You may have heard about diabetes before. Maybe you have a friend or family member who has it, or maybe your doctor has mentioned your blood sugar levels. But today we are going to talk in simple words. We will go through the signs that can show up before a person is officially diagnosed with diabetes. These are signs you should not ignore. Knowing what to look for can help you take action early. That way you can avoid more serious problems in the future. Many people have diabetes and do not even know it. That is why this video matters. Let us begin by understanding what diabetes is. Diabetes is a health condition that happens when your body has trouble handling sugar, which is also called glucose. Glucose is the main source of energy for your body. You get it from the food you eat, especially foods with carbohydrates like rice, bread, fruit, or pasta. After you eat, your body breaks down the food into glucose. Then your blood carries that glucose to your cells, where it is used for energy. But here is the important part. Your body needs a hormone called insulin to move that sugar from your blood into your cells. Insulin is made in your pancreas, which is a small organ behind your stomach. When you have diabetes, either your body does not make enough insulin or it cannot use the insulin well. That means the sugar stays in your blood instead of going into your cells. Over time, having too much sugar in your blood can damage your organs, including your heart, kidneys, eyes, and nerves. There are a few types of diabetes. Let us talk about the ones most people hear about. The first type is called type 1 diabetes. It usually starts when people are young, and it happens when the body stops making insulin. People with type 1 need to take insulin every day, but this type is less common, especially in older adults. The second type is type 2 diabetes. This is the most common form, especially in older people. It usually develops slowly over time. With type 2, the body still makes insulin, but it does not use it the right way. This is called insulin resistance. There is also something called pre-diabetes. This means your blood sugar is higher than normal, but not high enough to be called diabetes yet. Many people with pre-diabetes do not feel sick, but if you do not take care of it, it can turn into type 2 diabetes. So why are older adults more at risk? Well, as we get older, our bodies change. We may move less, gain weight, or develop other health problems that affect how insulin works. Some medications can also affect blood sugar. Even our muscles and organs respond more slowly to insulin as we age. That is why it is so important to know the early signs of diabetes. If we catch it early, we can make changes and avoid serious complications. Now let us talk about why early detection is so important. When diabetes is not treated, it can cause serious problems. It can damage your eyes and lead to vision loss. It can hurt your kidneys and even cause kidney failure. It can affect the nerves in your feet and hands, causing numbness or pain. It also increases the risk of heart attacks and strokes. But here is the good news. If we notice the signs early, we can take steps to manage blood sugar levels. That means eating better, moving more, and sometimes taking medicine. The earlier you start, the easier it is to control. You do not need to wait until things get worse. Many of the early signs are easy to miss. They may seem small at first, like feeling more tired than usual or needing to pee more often. But these are the body's way of telling you something is not right. In the next part of this video, we will go through each early sign one by one. I will explain what to look for, why it happens, and when you should talk to your doctor. Let us start now with the most common early signs of diabetes in older adults. Let us begin with the most common early signs of diabetes. These signs may not seem serious at first, but they can be clues that your body is having trouble with blood sugar. If you notice any of these, especially if you have more than one, it is a good idea to speak with your doctor. Number 1. Frequent urination. One of the first signs of diabetes is needing to urinate more often, especially at night. You may find yourself waking up once, twice, even 3 times in the night to go to the bathroom. This happens because when there is too much sugar in your blood, your kidneys try to get rid of it. They pull the sugar out of your blood and send it into your urine. That also pulls water from your body, so you end up making more urine than usual. If you are going to the bathroom more than usual, and it is not because you are drinking a lot of water or taking a water pill, this could be a warning sign. Number 2, feeling very thirsty. Frequent urination leads to the next sign, feeling very thirsty. When you lose more water through your urine, your body becomes dehydrated. This makes you feel the need to drink more water. You might find yourself reaching for a glass of water more often than usual. Some people feel like they can never get enough water. Now, everyone gets thirsty sometimes, especially in hot weather or after eating salty foods. But if you are thirsty all the time and it does not go away after drinking, it may be linked to high blood sugar. Number 3, unexplained weight loss. Another early sign of diabetes is losing weight without trying. This happens when your body cannot use sugar properly for energy. Instead, it starts breaking down fat and muscle to get fuel. You may notice your clothes feel looser or your face looks thinner. This kind of weight loss can happen quickly, sometimes 5 to 10 pounds in just a few weeks or months. That might sound good to some people, but losing weight without changing your diet or exercise is not normal, especially in older adults. Number 4, feeling very hungry. Even though people with diabetes often lose weight, they may also feel more hungry than usual. That is because the sugar is staying in the blood and not getting into the cells where it is needed. So your body feels like it is not getting enough energy, even though you are eating. You might feel like you are eating more than usual, but still feel tired and unsatisfied after meals. Or you might find yourself getting hungry soon after eating. Number 5, feeling tired or weak. Feeling tired all the time is another common sign. This is not the kind of tired you feel after a long walk or a busy day. This is a deep, ongoing tiredness that does not go away with rest. When your body cannot get the energy it needs from sugar, you start to feel drained. You may have trouble getting through your daily routine. Simple things like cleaning, walking, or even talking on the phone may feel exhausting. Of course, many older adults feel more tired as they age. But if this is a new feeling or it is getting worse, it could be related to diabetes. Number 6, blurred vision. Another early sign of diabetes is blurred vision. This does not mean total vision loss, but your eyesight might get fuzzy or out of focus. You might notice that reading becomes harder or that you cannot see clearly across the room. This happens because high blood sugar can pull fluid into and out of the lenses in your eyes. This affects the shape of the lens, which changes your ability to focus. If your vision gets blurry suddenly, or you notice it comes and goes during the day, do not ignore it. It could be an early warning sign. Number 7, slow healing of cuts and wounds. If you get a small cut or scrape, and it takes a long time to heal, that may also be a sign. Diabetes can affect blood flow, especially to your hands and feet. It also weakens your immune system. This means your body takes longer to repair itself. You might notice that small wounds stay open longer, or that scabs take many days to form. Sometimes the area may stay red or get infected more easily. Number 8, tingling, numbness, or pain in hands and feet. Another early sign of diabetes is nerve damage, which can cause tingling or numbness in the hands and feet. Some people describe it as a pins and needles feeling. Others say it feels like burning, sharp pain, or just like their hands or feet are asleep. This happens when high blood sugar starts to damage the small nerves in your body, especially in the fingers and toes. Over time, this damage can become permanent, so it is very important to catch it early. Number 9, dry mouth and itchy skin. Having high blood sugar can make you dehydrated, and this can cause a dry mouth. Your mouth may feel sticky or dry even after drinking water. It might be hard to swallow or speak. Dry skin is also common. You might feel itchy, especially in your legs, arms, or back. This is not the kind of itch from a bug bite. It is a dry, tight, uncomfortable itch that does not go away with lotion. Number 10, getting infections more often. Finally, if you seem to get sick more often or take longer to recover, this could be a sign of diabetes. High blood sugar weakens the immune system. That means it is easier for bacteria and fungi to grow. Women may notice more yeast infections. Men and women might get urinary tract infections more often. Skin infections like boils or rashes can also become more common. If you notice any of these signs, or a combination of them, it is time to check in with your doctor. These signs can seem small on their own, but together they may point to a bigger problem. Some signs of diabetes are not as obvious. These less common signs can be easy to miss or may be mistaken for normal aging. But they are important. Let us look at a few of these. Number 1. Changes in mood or memory. Many older adults notice changes in mood, thinking, or memory, but in some cases, high blood sugar may be the cause. You may feel more irritable than usual. You may feel sad, anxious, or easily upset. These mood changes can be linked to how blood sugar affects your brain. Diabetes can also make it harder to focus or remember things. You may find yourself forgetting appointments or having trouble following conversations. This is because your brain needs a steady supply of energy. When your blood sugar goes up and down, your brain may not get what it needs. Sometimes people think this is just getting older. But if the changes are sudden or getting worse, it is a good idea to get your blood sugar checked. Number 2. Recurrent urinary tract infections, UTIs. Older adults, especially women, are already more likely to get urinary tract infections, but diabetes increases the risk even more. When there is extra sugar in your urine, it creates a good place for bacteria to grow. This can lead to more frequent UTIs. Symptoms of a UTI can include pain when urinating, cloudy urine, a strong smell, and a constant need to go to the bathroom. In older adults, a UTI can also cause confusion or dizziness. If you are getting UTIs more often than usual, it could be a sign that your blood sugar is too high. Number 3. Dark patches of skin. One less known sign of diabetes is a skin condition called acanthosis nigricans. This causes dark, thick, or velvety patches of skin to appear, usually around the neck, under the arms, or in body folds. These areas may feel slightly raised or rough. They do not hurt, but they can look different from the rest of your skin. This happens because the body is making too much insulin, which affects skin cells. Seeing these dark patches is often an early sign of insulin resistance, which can lead to type 2 diabetes. If you notice these changes in your skin, even if you feel fine otherwise, it is worth checking in with your doctor. Number 4. Gum disease and dental problems. Your mouth can also show early signs of diabetes. High blood sugar helps bacteria grow, and that can affect your gums and teeth. You may notice red, swollen, or bleeding gums. You may have a dry mouth more often, or your dentures may not fit as well as they used to. Some people also notice bad breath that does not go away. If you see your dentist and they mention gum disease or infection, and you're also having other signs of diabetes, it may be time to get tested. Number 5. Vision changes other than blurriness. Earlier we talked about blurred vision. But diabetes can cause other changes in the eyes too. You may notice floaters, which look like tiny spots or threads drifting across your vision. You may see flashes of light or have trouble seeing at night. Over time, diabetes can lead to a condition called diabetic retinopathy, where the small blood vessels in the eyes become damaged. That is why regular eye exams are very important. Sometimes an eye doctor will notice signs of diabetes before you do. Number 6. Feeling very itchy in the genital area. High blood sugar levels can cause yeast infections, and these often appear in warm, moist areas of the body. One common area is the genital region. You may feel itching, burning, or discomfort in that area. This is more common in women, but men can experience it too. If these symptoms happen often or do not go away with treatment, they may be linked to diabetes. Number 7. Leg cramps or foot pain at night. Diabetes can affect the blood flow and nerves in your legs and feet. Some people feel cramping, tightness, or sharp pain, especially at night. This can be a sign that your nerves or blood vessels are under stress from high sugar levels. These symptoms might feel like ordinary leg pain at first, but if they happen often and come with other signs of diabetes, do not ignore them. These less obvious signs can be just as important as the common ones. They may show up before you even think of checking your blood sugar. If you notice them, especially if you notice more than one, it is time to talk to your healthcare provider. Coming up next, we will talk about what you should do if you notice these signs and what happens when you go in for a checkup. So you may be asking yourself, what should I do if I notice some of these signs? And that is an excellent question. The most important thing is to take action and not ignore what your body is telling you. Many people wait too long. They think they are just tired from aging, or they blame stress, weather, or food. But when it comes to your health, it is better to check and be safe. Here is what you should do if you notice signs of diabetes. Number 1. Make an appointment with your doctor. The first step is to speak with your doctor or healthcare provider. You can tell them you have been noticing certain symptoms. You might say something like this: "I have been feeling more tired than usual, and I have been going to the bathroom a lot at night. I read that these could be early signs of diabetes. Can we check my blood sugar?" Do not be afraid to ask. Your doctor will not mind. In fact, they will be glad you are paying attention to your health. Number 2. What tests will the doctor do? Your doctor will likely order one or more blood tests to check your blood sugar levels. The most common tests include fasting blood sugar test. This checks your blood sugar after you have not eaten for at least 8 hours. A normal level is under 100 mg per deciliter. If your level is 126 or higher, it may mean diabetes. Hemoglobin A1C test. This shows your average blood sugar level over the last 2 or 3 months. A normal result is below 5.7%. If your result is 6.5% or higher, that usually means diabetes. Oral glucose tolerance test. This test checks how your body handles sugar. You drink a sweet liquid, then your blood is tested over time. All of these tests are simple and safe. Some require fasting, others do not. Your doctor will guide you through it. Number 3. What if the results are not normal? If your blood sugar is higher than normal, but not yet in the diabetes range, you may have pre-diabetes. This means your blood sugar is rising, but there is still time to reverse it. Your doctor may suggest some lifestyle changes. These include eating differently, walking more, and possibly losing some weight. Even small changes can make a big difference. If your blood sugar is in the diabetes range, your doctor will talk with you about a plan. This plan may include a new meal plan, regular physical activity, blood sugar checks at home, medication if needed. Do not worry. Many people live long, healthy lives with diabetes. The key is to catch it early and manage it day by day. Number 4. What to bring to the appointment. To make the most of your visit, it helps to prepare. You can bring a short list of your symptoms, including how long they have been happening. You can also bring a list of your medications, notes about your eating habits, any family history of diabetes, questions you want to ask. You might write things down on a piece of paper or ask a loved one to come with you and help take notes. Number 5. How often should you check for diabetes? Even if you feel healthy, the American Diabetes Association recommends that adults over 45 get their blood sugar checked every 3 years. If you have risk factors like being overweight or having high blood pressure, you should be checked more often. If you already have pre-diabetes, your doctor may ask you to check your levels every year or even more often. Number 6. Watch your daily habits. If you are waiting for your appointment or want to start improving your health now, there are things you can do. These include: pay attention to how often you feel tired, thirsty, or hungry. Watch how often you urinate. Notice any changes in your eyes, feet, or skin. Keep track of your weight and appetite. When you start paying attention to your body, you become more aware of what is normal for you. That makes it easier to notice when something changes. Number 7. Do not panic. Take it one step at a time. If you do find out you have diabetes or pre-diabetes, do not panic. Many people live full, active lives with diabetes. The most important thing is to stay informed, stay active, and follow your doctor's advice. You do not have to fix everything in one day. Just take one small step at a time. Next, we will talk about some simple ways to reduce your risk of diabetes, or if you already have it, how to manage it better. If you have been told that you have pre-diabetes, or if you are worried about getting diabetes, the good news is that there are things you can do to lower your risk. These steps are also helpful for people who already have diabetes. You do not need to make big changes overnight. Even small improvements to your daily habits can make a big difference in your blood sugar levels. Let us look at some practical ways to take control. Number 1. Make healthier food choices. What you eat has a big impact on your blood sugar. You do not need to follow a special diet, but you should make more thoughtful choices. Try to eat more vegetables like broccoli, spinach, carrots, or green beans, whole grains like brown rice or oatmeal, lean proteins like chicken, fish, or beans, healthy fats like olive oil or nuts. Try to eat less white bread, sugary cereals, and white rice. fried foods and processed snacks, sugary drinks like soda and sweet tea. Let us talk about sugar for a moment. The American Diabetes Association recommends limiting added sugar to less than 25 grams a day for women and 36 grams for men. That is about 6 teaspoons for women and 9 teaspoons for men. To put that in perspective, a single can of regular soda has about 10 teaspoons of sugar. That is more than a full day's limit. A healthier alternative is water, unsweetened tea, or sparkling water with lemon. Number 2. Watch your portion sizes. Eating too much at one time can cause your blood sugar to spike. You can help manage this by eating smaller meals more often and avoiding second helpings. Use smaller plates if it helps. Half your plate should be vegetables, 1/4 protein and 1/4 whole grains. Number 3. Move your body more. Exercise helps your body use sugar better. You do not have to go to a gym or run. Simple movement like walking, gardening, or dancing is enough. Aim for at least 30 minutes of activity 5 days a week. That might sound like a lot, but you can break it into smaller parts. Even 3 10-minute walks each day can make a big difference. Think of it like this. Walking at a gentle pace for 30 minutes helps lower your blood sugar, the same way taking certain pills might. That is powerful. Number 4. Lose a little weight if needed. If you are overweight, losing just a small amount of weight can help. You do not need to lose a lot. In fact, studies show that losing just 5 to 7% of your weight can reduce your risk of developing diabetes by more than half. For example, if you weigh 160 pounds, losing just 8 to 11 pounds can already make a difference. Losing weight slowly is safer and more likely to last. Focus on eating better and moving more, rather than counting every calorie. Number 5. Check your blood pressure and cholesterol. Diabetes often comes with high blood pressure and high cholesterol. That is why your doctor may want to check these numbers too. Keeping your blood pressure below 130/80 and your cholesterol in a healthy range helps protect your heart and kidneys. Number 6. Quit smoking if you smoke. Smoking raises your blood sugar and damages your blood vessels. If you smoke, quitting can greatly reduce your risk of complications. There are many tools available to help people quit smoking. Your doctor can help you find a plan that works. Number 7. Manage your stress. Stress affects your body in many ways, including raising your blood sugar. Try to find healthy ways to relax. You can try taking deep breaths, listening to music, spending time with family or friends, doing light stretches or gentle yoga, praying or meditating if that is part of your routine. Even 5 minutes of calm time each day can help your body reset. Number 8. Get enough sleep. Your body needs rest to work well. Poor sleep can raise your blood sugar and increase your hunger. Try to get 7 to 8 hours of good sleep each night. Go to bed at the same time each night and turn off screens or bright lights before bed. If you have trouble sleeping, talk to your doctor. Number 9. Stay on top of checkups. Even if you feel fine, regular checkups can help catch changes early. Make sure to visit your doctor, eye doctor, and dentist regularly. Ask about having your blood sugar, blood pressure, cholesterol, and kidney function checked at least once a year. Number 10. Build a support system. Do not try to do this alone. Managing your health is easier when you have support. Talk with your spouse, family, or friends about your goals. Join a walking group, a healthy cooking class, or a diabetes support group. Having someone to encourage you or walk with you makes the journey less stressful. We have covered a lot today, so let us take a moment to review the most important points. Diabetes is a condition where the body has trouble using sugar for energy. As a result, sugar stays in the blood, and over time this can cause serious health problems. But if we catch the signs early, we can take action and prevent these problems from happening. The most common early signs of diabetes in older adults include going to the bathroom more often, especially at night, feeling very thirsty, losing weight without trying, feeling more hungry than usual, feeling very tired, blurred vision, cuts or wounds that heal slowly, tingling or numbness in the hands or feet, dry mouth and itchy skin, more frequent infections. We also talked about less common signs that are easy to overlook, such as mood changes, memory problems, dark patches of skin, or frequent urinary tract infections. If you notice any of these symptoms, do not wait. Make an appointment with your doctor. Ask to have your blood sugar checked. You have the right to speak up about your health. Your doctor may order simple blood tests like fasting blood sugar or the A1C test. These will help you and your doctor understand what is happening inside your body. If your levels are high, there is still hope. You can take steps to lower your blood sugar and protect your health. Even small changes like walking more, eating more vegetables and drinking more water can make a big difference. Remember these key tips to reduce your risk of diabetes. Choose healthier foods and limit sugar. Be active. Even gentle walks help. Lose a little weight if you need to. Quit smoking. Get enough sleep. Manage stress in healthy ways. Visit your doctor regularly. It is never too late to make a change. Even if you are in your 60s, 70s, or 80s, your body will respond to better care. The goal is not perfection. The goal is progress. One better meal, one extra walk, one day at a time. Diabetes does not always show loud warning signs. Sometimes it whispers. That is why it is important to listen to your body, notice what is different, and take action early. You do not need to do it alone. Talk to your family. Ask your doctor questions. Share what you have learned today with a friend or loved one. Thank you for spending time with me today. I hope this video helped you feel more confident about recognizing the early signs of diabetes and knowing what to do next. Your health matters. You matter. Take care of yourself and take the next step toward a healthier, stronger future.